We're going to go ahead and I'm going to write a pretty complicated note tonight. Actually, I'm going to try to write two notes. We finished our little lecture very quickly and concisely, so let's go ahead and I'm going to type in my initials. The date of service is automatic unless you want to change it. It would look something like that. You can change it. Reason for visit. So tonight, one of the difficult things when you're first learning about C notes, one of the most difficult things you can do is try to decide, where do I begin? Like, you know, if you're doing root canal, easy. You go to root canal. Well, here we're going to do something kind of complicated, where I'm going to incorporate a consultation, a consent form, and we're going to do an examination on the patient that we don't know what's going on. So we're going to say, reason for visit. We're going to have pain, lower right side. You can see I type very, very slowly. Lower right side to chewing. We don't know what tooth it is. We don't know where to begin. Well, anytime you see this where you don't know what tooth to work on, you don't know where to begin, it hasn't been diagnosed, you want to begin with examination. So we hit done, and here are our departments of dentistry. So we're going to go way over here to the beginning, and you'll see exams, operative, endo, prosto, ortho, hygiene, pedo, facial aesthetics, which is Botox, TMJ, TMD, oral surgery, implant, and perio. In this area, these are all kind of similar. This is placing implants. Oral surgery is and perio have a lot of crossover, and you can grab things from different areas. But let's start off with examination. So I'm going to show you how we do this. In these treatment areas, you can always grab anything. So treatment selection, we're going to do exams. So we're going to put, click here, notice the teeth that we affectionately call the grill. We're going to press 31, 30, 29, 28. And by the way, today we just had a new release. Let's see, it's version 1.3.1, I believe. Is that right, Scott? And has a lot of updates in it, some material acquisitions that we included, that kind of thing. So a lot of little updates. We try to update about every 2 or 3 weeks. But we also, one of the things that we have to do is we have to get through to Apple. Every time we go to push a build right now, it goes to Apple. They have to approve it, and then we can launch it to you guys. The great thing about C Notes is your download normally is automatic. Your update, you won't even know you get it until I send out an email, but you'll have already had it. So anyway, so we're going to hit these 4 teeth and hit done. So now you see the exams button, and now we're going to click on that, and you see all these little paper trail, a little color trail. So before every treatment, you're going to see a pre-op button. Pre-ops vary according to many are similar, but like prosto and operative might be similar, but endo is going to be unique, and perio would be unique, etc. unto itself. So let's go look in pre-op. Now notice how it always reads right to left as you approach things, and then top to bottom, just like a book. So this is called the treatment view screen, and we're going to say, let's say the patient comes in, we're going to take some intraoral photos. So notice I clicked on intraoral photos, diagnostic photos, intraoral, hit save, and you see the first toast that pops. It's writing an impression. It's writing a what we call a toast. So the impressions, let's take upper and lower impressions. Let's say we haven't seen this patient in a while, and we're going to take an X-ray. Now, anytime you see this little icon, you see a little icon down here that looks like a molar. That's telling you that the sentence is going to ask you to please select a tooth. So we're going to select multiple teeth here. So this is a little complicated. So we're going to say periapical X-ray, and we're going to hit save. So it'll write that note. And vitals you can record. We can record medical history. Let's say patient hadn't been here in 3 years. We're going to say new medical history was taken. Now, new medical history many times is a piece of paper, or it's written on an iPad associated with your practice management software. Or if you want to update, you can update with this right here. You can also go to current meds. So let's close out here. That's called a modal view screen. And pre-med, let's say the patient pre-medded for, let's say, Zithromax, and we'll hit save. So we're going to close that out. Notice we went all, on the left side, we went down all these areas. We skipped vitals, and we're going to click close and get out of that. Now, new patient is new patient findings. What we're getting ready to do with new patient findings, it's actually a new patient diagnosis. So what we're doing, and I thought it was going to come out in this build, but we didn't have time to do it because it was very important that we get this build out. But new patient findings is going to go at the end of examination. So essentially it's going to go way down here at the end where you'll be able to diagnose, state your diagnosis later. But let me show you what we have. Okay, so let's go to periodontics. And First thing we're going to say, we're going to go to bleeding. And you can see here it says anterior, generalized, posterior, no bleeding present, and a severity. Well, let's say I want to mark some teeth. So we fire the grill where it says teeth. I'm going to hit 30, and let's hit 29, 28. And I'm going to put light bleeding and hit save. Okay, now I'm going to go back to 30, and we're going to say it's more light to moderate, around 30. So it gives you a little indication something may be going on. Let's go to pocketing. And I'll show you how this works. We'll go, once again, 31, 29, 28. And all you're doing is recording these things. And I'm going to put distal buccal, distal lingual, mesial buccal, mesial lingual. I'm going to put 3 millimeters. Okay? So we're going to hit save. So we just recorded all those pockets at one time. You can see how fast it goes. Now let's go to 30. And I'm going to put distal buccal, distal lingual. And I'm going to put 5. So we've got a little issue there going on. All right. What about recession? Well, let's say on 30, we have buccal, and we're going to put 2 millimeters recession. So we know this tooth is kind of involved. Mobility, you can go through stain, plaque, calculus, attached gingiva, etc. So let's get out of here. And now I'm going to go to dental conditions. We're going to say, well, what's going on? Well, let's say we see some secondary decay, and we could say it's associated with tooth 30, and we could just say it's occlusal. Okay, let's just put that. And now let's go to, we see some amalgams in this area, and there's 30, 31, 29. So look what it says. As soon as I hit 30, 31, 29, tooth 31, it's asking you what surfaces. Let's say occlusal. Hit commit. What about 30? What about 30? Let's put MOD, commit. And what about 29? Let's put occlusal and commit. So you can also go through other things here. We have everything from fixed detachable hybrids, all kinds of pre-existing conditions. We have failed conditions. If you want to put failing amalgam, you can put, you can mark 30, and we can put MOD, failed amalgam. So let's get out of here. And let's go to endodontics, endodontic examinations. Let's look at symptoms. What kind of symptoms do we have? Well, let's say, for example, this patient comes in sensitive to chewing, so it's occasional, it's sharp and spontaneous. And let's say it's lingering. When did it happen? Let's say 2 days ago. So you can see how fast we're writing here. And let's see, location is localized. It's provoked by chewing. Let's say cold and heat. So we still don't know what tooth it is, but we know we have heat and cold. Is there any swelling present? You can actually connote the negative. There's no swelling present. So we'll get out of there. So now we took an x-ray, and we said we took an x-ray. Now we're going to talk about that x-ray. What do we find in this x-ray? Well, we're going to say, notice how the grill changes from a normal looking tooth to endodontic looking teeth. So we're going to say 31, 29, 28. And let's do 30 also. Widen PDL. Okay. Now, on the lower right here, in this area, in this trough, you can see we can create a diagnosis in any time. But let's continue with our testing. So let's do some cold tests. I'm going to put 31, 29, 28, and when they tested normal. Let's go to 30, and we're going to say it tests mild to moderate. So hit save. Let's go to heat testing. Click on heat. We're going to do the same thing. We're going to have 31, 29, 28, no response. Or I should say normal. Normal would have been a better response. And we'll say number 30, we'll put moderate to severe heat. So we know all of a sudden we can make a diagnosis. And but I'm going to keep going one more. Let's say I'm not going to tap on it. Let's do a tooth sleuth. And tooth sleuth, you can just put 30, and let's say moderate. So we know we have an irreversible pulpitis on this tooth, probably from a crack. And so we're going to go ahead and close out of here. So now we know that this tooth, number 30, needs a new restoration. It needs endodontics. So let's talk to the patient about endodontics. So I'm going to get out of exams, and the way I do that is I'm going to go up to endo in the department, click endo, and I hit root canal. And we're going to talk about tooth 30 in specific. And so now you see RCT in addition to the exams where we were. So RCT, we don't have to go through pre-op because we've already done that. Let's go to patient consultation. So who was present? Let's say the patient was present there and a dental assistant, including yourself. Proposed endodontics, root canal. Patient education of conditions. Well, let's see. We have some decay. We have repeated procedures. We have crack. We have some inflammation and pulpal trauma. Pulpal inflammation and trauma. The purpose, well, we don't know if it's infected, but we know it is getting infected, so we can talk about that. We want to save the tooth. We want to remove the pain source, and we want to improve your restorative result. Local risk factors. Well, the guy hadn't been in 3 years, so we're going to say poor oral hygiene, lack of professional cleanings, failing restorations, caries, and let's say trauma. Any systemic risk factors? No. What about treatment options? Well, we're going to talk about root canal and crown. We're going to talk about alternative treatments such as implants. What if the patient doesn't have any money? You can talk about just doing a pulpotomy for a while. You can also talk about no treatment. And so we can go to a treatment discussion where we talked about treatment of the pulpal tissue, chemical therapy, cleaning and shaping. We're not going to talk about external filling methods or bony perforation repairs, etc., bleaching or amps. We're going to talk about endodontic outcomes and healing times. Then we're going to talk about operative risks discussed. You might have some swelling. You might have some bruising from the anesthetic. You might have some lymph node swelling. You may have some post-op pain. You could have an infection. You could have an antibiotic reaction. You could have a fever. You could have some discomfort, hypersensitivity, and the tooth may even fail after all this. So these are the things that the patient has to know about. If they don't have anything done, they could have morbidity, which would be horrible. You can have pain, more caries, you can have an aesthetic compromise, restorative compromise. Normally psychological implications are for front teeth. And you got to tell them that it may require future treatments. What kind of treatments? Well, drug therapy, procedural retreatment, surgical augmentation, extraction, etc. Prosthodontic treatment, those kind of things. Now, we just discussed what was in the consultation with the patient. Now, what I do with my iPad is I actually hold it in my hand and I go through these things and talk to the patient about these as we are going. So what happens here next is I can go to endodontics informed consent. And look what happened. Because of everything that I said, this, what we populated, because of cognitive engineering, we populated and created a custom consent form. So the patient should read this. Who is present at the consultation? Well, the patient and dental assistant. They need to accept, let's get rid of that. They need to accept, edit, or decline. I just got rid of that. So anyway, we can type that back in. And they go ahead and read each one and accept, line item by line item, or I should say paragraph by paragraph. And you can see how complicated it goes. Now, they keep going. When they get finished, they sign it and save the signature. And then we can go ahead and hit save. And it'll tell you that it's been saved. So now, this particular consent form, when we go to conclusion, you're not going to see it, but it gets printed. It's easy to print, and it becomes a part of the note. You just won't see it when you go to review your note. But you will review the contents of that in conclusion. So let's go to conclusion, and we're going to review note. And you can see pain lower right side to chewing, exams 28, 29, 30, 31, pre-op, periodontics exams, dental condition exams, endodontic exams, root canal 30, patient consultation, endodontics informed consent. So pre-op, we took diagnostic photos were taken, maxillary mandibular alginate were taken, periapical x-ray was taken for 29, 30, 28, and 31. New medical history was taken. The patient was medicated with Z-Pak. And we go on and on. Periodontics, it talks about all the bleeding points and what we found. The dental conditions talks about the secondary decay, the amalgams where they're located, and the failing amalgam at number 30. Endodontics, examination. Now notice how we have examinations at the top, and then it goes through all the criteria. So in endodontic examination, the patient reports pain as described as occasional, sharp, and spontaneous. So the duration is lingering, and it goes on and on. All the tests It says here, for example, radiographic examination revealed the following anatomical anomalies, widened PDL, and cold tests were performed, etc., and the results. So then patient consultation, here's everything you talked about. Now, it's not, the patient consultation right here is not the consent form. It's just the note of what you talk to the patient about. And that's the beauty of this. When you learn how to do this, this can be written at the time of service or shortly after. But when you do a consultation, you want to have that iPad with you at the time of service. So it can be printed or emailed. This is called, in the upper right-hand corner, that little flat rectangle with the arrow is called a share sheet, and allows you to see what is available as far as sending it. What you do with this next is you send this to your practice management software, or you print it. Either way. The beauty about, let's see, we just came out with iOS 10. Apple came out with it this past week, or last week rather, and one of the beauties of it is you're now capable of sending, you can send this note via email, and it's an encrypted PDF with the same encryption that you use for credit cards. So it's pretty solid encryption. It is HIPAA compliant. This type of encryption is what they allow according to the Compliance Act. And also you're capable of using a secondary layer of encryption if you use Google, not Google, if you use iCloud Drive. There are many different drives out there. Google Drive is good and all those, but right now iCloud Drive is encrypted with the same AES encryption methods. That is just a second layer if you choose to use it, and it's almost like instant messaging. It's very, very good and easy. So, and it works for, you can get iCloud Drive for your PC and drop it in there for Dentrix users, etc., and EagleSoft. So let's go ahead and close this out. And now we're going to close out our trough, and we're going to clear data. I'm going to go through one more so you get an idea. Let's do John again, and initials of the person writing the note. And let's say we're going to do something complicated. This I'm going to do an abbreviated version, but this is in the master class that I taught last week. And we did, let's use 8. Tooth number 8. We're going to say extraction, bone graft, and implant placement. Sorry for my writing, but I'm not going to fix it tonight. So there we go. So now let's move our departments over here to the right. And we got great TMJ examinations too, but here we're going to function primarily in oral surgery, implant. We could use perio too, but we're going to function in these two areas. So we said toothache, right? So I'm going to click oral surgery, and we're going to remove a tooth. So emergency, tooth removal, endodontic surgery, it goes all the way down. You can study these things. Tooth removal, and we're going to put tooth 8. And so it says, do you want, at the bottom, additional treatment selections? Let's hit yes. What else are we going to do? We're going to place a bone graft. And we're going to put tooth 8 also. Now we're going to hit done. Now I'm going to do one more thing. We're going to go to implant now, and I'm going to grab implants because we're going to place an implant today. I'm going to put tooth 8. So I just went across departments. It's one of the hardest things to realize is that you can do that here. So let's go to tooth removal first. Now the pre-ops are all going to be identical. So we're going to go to, and let's say we already marked the conditions. The patient's already been diagnosed. If you want to take vitals, you can. Review med history, we could say no deltas, you see no changes up here, so we go ahead and hit that. You want to confirm it, and then we'll click out of there. We can go to, we didn't have to take pre-op records. Let's go to pre-surgical management. We use plaque control techniques were implemented, talking about atraumatic brushing technique while they're preoperatively before they have their extraction. Systemic concerns addressed, chlorhexidine rinses, surgical templates, let's say, antibiotics and analgesics. So these are all the things that we covered. Let's go ahead and give some anesthetic. So we give topical. This is called a picker, and you hit save. We're going to hit local infiltration, lidocaine. Let's use 1 carpule. And let's do a palatal block, and let's use, let's say, septicaine, and we'll use just maybe half carpule or less, maybe a quarter carpule, and see if that's enough. So let's go ahead and click off of that picker. It goes away. and we'll go ahead and close out. Now, patient consultation, they've already been consulted, they've already signed the informed consent, and we can do a traditional extraction, we can do atraumatic or impaction removal. We're going to do atraumatic. So we've got atraumatic, and you can see how we create it now. Once again, you see the little molar icon. I'm going to press teeth. It's asking you to give me a tooth number so I can write a beautiful sentence. Select teeth for removal, and we're going to press number 8. And let's say we're going to lay a flap. So let's lay a flap, and let's do, we're going to get into flap in just a moment, but let's do periodontal attachment severed, periodontal ligament detached, purchase creation, elevation, and we removed it, and we do a socket debridement, and we're going to hit save. Do we have to soft tissue close here after atraumatic extraction? No, because we're going to bone grafting. Any complications? No, we're not going to go in there, not for tonight. So we're going to hit close, and now we're going to, we're finished. We don't have to do any more here. So now we're going to go to bone grafting. Pre-op is the same, so we've already been through pre-op. Patient consultation has already been done. We're going to do a socket preservation technique. So here we go. We're going to press socket preservation. Let's measure that root that we took out. I'm going to say it's asking you to make a selection. We're going to click that. The root length, and let's say it's 12 millimeters. It's good. And nice big tooth. We're going to say we had a, I don't know, let's say 2-wall defect, and we'll hit save there. And you can also do socket debridement there if you want to, so we'll hit that again. Now, soft tissue flap raise. We're going to go in and say we're going to use an envelope and hit save. Notice I save often on this screen. Where there's a save button, you want to save often. As soon as you finish one of the buttons on the left and finish everything in the button, you want to go ahead and save often. So incision, let's do a palatal crestal incision, and let's say we do a papillary sparing technique, and with a little relieving area. So we'll hit that. Dissection, let's say, is full thickness. And if you want to use a membrane, you can use a membrane. We're not going to do that. Bone graft materials, we have autogenous, we have alloplast. We're going to use a xenograft, and we're going to use FDBA. And reconstitution method, let's use sterosaline. If you want to do PRP, we also have that. And so the graft material is placed. And if we place the membrane over it, yeah, calcium sulfate barrier, no. So we just placed it, and no membrane is fixed. So let's go to, we're going to close that out. We finished that. Let's go to graft information. Well, the brand. Let's use Zimmer. And lot number could be, you know, whatever. Expiration date could be, and hit save. So it marks these things down. And so let's go to flap placement. Are we going to place the flap? Well, not really, because we still have to place a bone graft. But notice this information is in, I'm sorry, not the bone graft, but the implant. So let's go ahead and get that done. So now we're going to go to implant placement. Pre-op is already taken care of. Patient consultation taken care of. Informed consent. Implant selection. We can go ahead and go with the measurements that we, this is really for pre-operative things, but we're going to put wide, let's put 5. Hit done. So do that. Implant guide, we're going to hit 8. And let's put a Zimmer, because we feel Zimmer friendly tonight. TSV, platform diameter, 4.3, length 10 millimeters. Actually, let's do 13. Lot number, you're going to have to put these things in. It's very important. Expiration date, 23. Reference number, and all these things are important to save. So this is for tooth number 8. If you had multiple teeth, you select the teeth, and it will ask you to put in the information for each one. And so let's hit close. Surgical guide selection. Let's say we did a CAD CAM, laboratory fabricated with completely limiting, and hit save. So let's go to flap design. We already talked about that. We go to incisions, and we already talked about that. Let's go to dissection. We talked about that. So all these things, bone grafting materials, we talked about that. You say you can do this internally if you want, but I'm showing you how to write it in different manners. So implant, let's go to implant placement, insertion, the surgical guide. So the surgical guide was placed. The driver we chose is a surgical driver. The final location is going to be level with the buccal bone. Our final torquing, let's say it was to 45 Newton centimeters. We're going to confirm X-ray confirmation and sleeper implants if you want to. I'm going to close that out. And now we can go to finish. Let's say we did a two-stage healing screw was placed. And let's do, now we can reposition the flap. Replacement, we want tension-free verification. We're going to smooth the incisal edges. The epithelial line, well, we won't do that. We're going to coronally reposition and place and use Decadron to replace the flap. And closure, we can use, let's say, 4 sutures with, I don't know, Vicryl. And lot number, expiration date. And you can see how fast we can write these notes. So if there are any complications, you can mark that, but we're not going to go into that. So let's go to conclusion and see what we wrote. Oh, post-op instructions. Well, let's say we going to do some post-op instructions in oral surgery, verbal and written for bone grafting, extractions, implant placement. And see that this is learning your pathways. Next appointment, we're going to go to, let's say, implant, and we'll put, what tooth? It was tooth 8. Implant, not follow-up, we'll do implant placement, and we'll do follow-up 1 week. Hit save, we'll close, and now we can review the note. Once again, we're in the conclusion panel. We go to review note, and here we go. 8 extraction, bone graft, implant placement, tooth removal, atraumatic extraction, bone grafting, socket preservation. And you can see as we go through here, this beautiful pre-op, the atraumatic extraction, the socket preservation, bone grafting, the implant placement, and the flap position replacement, post-appointment instructions, next appointment, and look what we have down here. We have the kind of implant that we place and all the things that are involved in it. So this is what you can do with the C-Note. This is called an interactive PDF document. So you can see how well it's can be written. And when you learn your pathways, this literally would take 3 minutes to do. And that's the beauty of C-Notes. So then it can be placed in your practice management software, or it can be printed, and or both.